While you are becoming familiar with this sequence, pause the video to practice each activity. Eventually, you will not need this video in order to do this sequence. The approach to these mobility sequences is to demonstrate activities that can be done throughout the day. The more you can find ways to incorporate this sequence into your daily life, the more benefit you will find. Fitness is a daily lifestyle that can be improved with small steps throughout the day. The Spinal Health Mobility Sequence floor version is designed to work your entire spine. Each stretch has its purpose, and I recommend holding it for 30 seconds to up to 2 minutes. And it is the combined value of all these stretches that improves your spinal health and fitness. To begin, we're going to stretch the posterior chain, using the simple tennis ball and working at our feet. Gently massage your foot back and forth for up to a minute. The posterior chain is the band of muscles that start from the feet and ascend all the way up to the neck, along with all of its connective tissue called the fascia. Allowing these tissues to have good flexibility and motion up and down the spine is essential for good spinal health. I recommend 1 minute of the tennis ball massage, and then you drop the heel and stretch the neck for another minute. Then you switch feet for 1 minute on the tennis ball massage and 1 minute with the heel neck stretch combination. Here I'm showing the same sequence but from a different angle. Now proceed to do the half kneeling position with the rear foot slightly outward, the front foot directly below the knee, your back straight, and slightly glide forward. Do not arch your back, but keep your back straight and only glide forward. This is the best way to stretch the iliopsoas muscle, which is known as the hip flexor muscle. Next, I'm going to point to my butt muscle, called the gluteus maximus muscle, and after about 10 seconds of the gentle glide forward, I'm going to squeeze my butt muscle to give it some strength training. Now here I'm bringing my right arm overhead, which is opposite of my rear foot, and I put a little stretch into my elbow. This stretches the right quadratus lumborum and latissimus dorsi muscle, two really important muscles of the back. Next we proceed to stretch the front thigh muscle called the quadricep. This does require some balance, and you might want to put a cushion underneath your knee to make it more comfortable. Now we're going to switch and show it to you from the other side. Right foot back with the right heel slightly outward, slight glide in my hips while I keep my back straight. Consider this sequence 1 of this routine. Then sequence 2 would be squeezing the buttocks muscle called the gluteus maximus as you're slowly gliding forward and backwards. The gluteus maximus muscle is the opposite muscle, the hip flexor muscle. The gluteus muscles are opposite of the hip flexor muscles. The combined efforts of hip glide with butt squeeze helps to improve and maintain hip muscle balance. Sequence 3 would be the latissimus dorsi quadratus lumborum stretch. The fourth and final sequence will be the thigh stretch of the quadricep muscle. Do each sequence for 30 seconds or 1 full breath. So this entire kneeling sequence should take at least 4 minutes to complete. Now transition to your knees. Put your hands above your head and lean back in order to stretch the upper back as well as the latissimus dorsi muscle. The latissimus dorsi muscle attaches to the upper arm, but then it also goes down to the hips and crosses and helps support the sacroiliac joint. There are various ways of actually doing the stretch. You can hold it as shown. You can rock back and forth. You can use a physio ball. Place your hands or your elbows on it. You can use a foam roller as well. Or you can also use a chair with wheels. The ability to rock back and forth will help stretch out the latissimus dorsi muscle. as well as give support and stretch to the sacroiliac joint. To stretch the sacroiliac joint, you're going to lay on your back and first bring your left knee to your chest, then hold it. Then you will transition to your right knee to your chest and hold that stretch. Next, we move to a sacroiliac lumbar stretch. Bring the left knee across the body, across the right leg. Hold this. You can also increase the stretch by extending the left foot. Then you switch and bring the right knee across the left side of the body, and then extend the right foot forward. You can add an upper body stretch by trying to keep your shoulders as flat on the floor as possible. Now we start to stretch out the diaphragm. Gently place your fingers underneath your ribs. Press gently upwards and breathe into your fingers. The diaphragm is an important muscle of the low back stability, and it can also spasm and tighten. So just gently breathe into your fingers for 1 to 2 minutes. Next, we move into lumbar flattening, which is a way of mobilizing the small muscles of the lumbar spine. Lumbar flattening is when you gently rock your hips back and forth, trying to press your spine to the floor. Please see my instructional video on lumbar flattening for more details on how to do this. Now we move into doing pelvic bridges. This basic core strengthening routine helps to integrate the different regions that we just stretched in order to help improve muscle memory of the lumbar spine. You can hold the bridge for 5 to 10 seconds. You can try to do 5 to 10 bridge ups in a brief period of time. You can also reposition your hands from the floor to across your chest to increase the challenge. Or you can also bring your hands behind your head and start lifting one foot and then the other. These are all different ways to increase the challenge of the pelvic bridge. The final floor-based activity is improving spinal extension. So roll on your stomach, lay your chest on the floor, then gently lift your chest off the floor as high as you can. Like all the other exercises, you can hold this stretch, you can alternate it and move back and forth. You can do a combination of both holding and alternating back and forth. Like all these other exercises, the goal is to start off with maybe 30 seconds and work your way up to doing this for 2 minutes. Now we transition from the floor to doing the door frame full body mobility sequence. Here I'm going to demonstrate how to do a full body squat using the door frame. Simply place yourself alongside the door, grab onto the door frame, squat as low as you can. The key to this activity is using the door frame to provide the balance you may need so you can get as much mobility in your lumbars, hips, knees, and ankles as possible. While you are becoming familiar with this sequence, pause the video to practice each activity. Eventually, you will not need this video in order to do this sequence. The approach to these mobility sequences is to demonstrate activities that can be done throughout the day. The more you can find ways to incorporate this sequence into your daily life, the more benefit you will find. Fitness is a daily lifestyle that can be improved with small steps throughout the day.